Hello, everyone. This is Cognitive Theory, a review, brought to you by Paul Gygos, Kylie Seymour, Giselle Pisani, Katie Osler, and Katie Galligan. Building off of earlier behaviorist theories, cognitive theory is grounded in two main principles. One, that thoughts, not just consequences, influence behavior. And two, that behavior can influence emotions and thoughts. Cognitive theory has many strengths, including that the theory explains behavior and thought patterns, which makes intervention easier and more effective than other treatments. The concepts are clear and well defined, which increases fidelity to and efficacy of treatment. There are many key concepts associated with this theory, including punishers, reinforcers, that we'll get into in more detail in a moment. The theory brings excellent use to microsystems treatment one-on-one because it really looks at behavior and thought patterns, which can be easily tracked within an individual throughout their change process. And there's also evidence of cross-cultural applications, and it can be used with a wide variety of individuals, populations, with a vast array of problem issues. Also, we're going to get into that in a second. There are some limitations that are noteworthy. So one of the main ones is that it often seats the social worker in the seat of the expert, provides too much authority to the social worker, which can create a challenging power differential if you don't approach that mindfully. It's not as helpful at meso and macro level of treatment, and it may not be appropriate for clients with intellectual or cognitive disabilities or clients with co-occurring diagnoses or complex trauma. However, there's a lot of research being done to the way to modify cognitive theory into different models that can be used. The research is still building. Practice settings include residential treatment programs, group homes that house children, day schools for children with behavioral or educational conflicts, juvenile justice and adult forensic programs, and a variety of outpatient treatments for children and adults, such as community mental health, where a lot of social workers work in direct care practice using this theory. Practice settings and diverse clientele. So one of the strengths of this theory, as mentioned earlier, is that it really can be utilized with a diverse population of clients, including children, adolescents, and transition age youth or TAY, and older adults. It can also be applied to working with clients who suffer from a number of different disorders or diagnoses, including trauma, panic and anxiety disorders, depression, eating disorders, bipolar, schizophrenia, and alcohol and drug addictions. Lots of practical use. It can also be applied during all of the stages of the change process or developing the therapeutic alliance between social worker and client. For instance, social workers use modeling to orient their clients to services. They use shaping to adapt their approach and communication through paying attention to positive or negative reinforcements from the client. So positive reinforcements from the client tell us at the beginning of the therapeutic alliance that things are going well, our communication style is a match for the client. Negative reinforcers from the client, on the other hand, would signal a misunderstanding or desire for a new approach within this theoretical framework. Applying to assessment, cognitive theory is very focused on data collection during the assessment, and social workers are interested in gathering data on antecedents of a behavior, so what comes before the behavior, environmental reinforcers and punishers that increase or decrease the behavior. They're interested in meaning that clients associate to various experiences or attach to various experiences. And we get at that through Socratic interviewing, which can help identify thinking errors or errors of logic associated with undesirable behaviors, for instance, that the client might be working on. And then it helps social workers dig deeper into the schemas and core beliefs associated with problem behaviors. Application during goal setting. SMART goals are very important within this theoretical framework. There's different acronyms for SMART goals. I will use the ones outlined by our text, which is that the goal should be specific, measurable, action-oriented, realistic, and timely. So for instance, a goal like I want to be healthier wouldn't be appropriate within this theoretical framework. You would want to reframe it to be specific, measurable, action-oriented, realistic, and timely, such as I want to lose 15 pounds within the next 6 months by not overeating and by exercising at least 30 minutes a day. The principal applications during intervention. Again, modeling, shaping, positive and negative reinforcement comes back. Social workers use modeling to model appropriate behavior and forms of communication. We shape through positive and negative reinforcements built into the intervention. Punishment when appropriate. This is a bit controversial, but punishment might, for instance, be appropriate within a setting, a group home setting for children, where if a child is acting out, they may have no privileges for a period of time to extinguish that behavior. Psychoeducation and helping clients identify triggers is also important during the intervention, so that once they're identified, desensitization can be applied to extinguish negative emotional reactions or thought processes that are problematic. Evaluation applications. Cognitive theory, again, lends itself better to evaluation due to how data focused this theory creates within the intervention. And evaluation would examine changes in thinking patterns, emotion, and behavior through a wide range of standardized measures, behavioral observations, and self-report within sessions. Termination. Due to the wide variety of populations served and varying depth and time of intervention, the closing of the therapeutic intervention varies widely. However, time and attention really needs to be paid to the significance of the relationship, and termination should have occurred, actually, a discussion of termination during orientation and engagement to avoid negative outcomes associated with the termination, such as feelings of abandonment. Here are references. Thank you guys so much for your time, and a shout out to my team who did a great job. Thank you so much.